According to the Center of Disease Control and Prevention, there are 26 million people in the United States who have diabetes. However, only about 5 to 10% have type 1 diabetes. Kristen Trengali is a type 1 diabetic and has had the disease for most of her life.
I've had it for a little over 16 years. I was diagnosed in May of 1997, and that was a couple days before my 4th birthday.
Type 1 and type 2 diabetes are very different from one another.
Type 1 is an autoimmune disorder and has a pretty rapid onset with symptoms developing in 1 to 2 months and absolutely requires insulin.
Type 1 continues to be filled with unsolved problems researchers are trying to crack.
We have no idea what causes it. We are studying 8,000 kids right now. We're following them literally from birth to age 15 to find out what that environmental trigger is.
If you have type 1 or type 2 diabetes, you do have options. You can always turn to the Shands Medical Plaza right behind me and go to the Diabetes Self-Management Center, where counselors can help show patients how to own their disease.
The University of Florida Diabetes Center of Excellence is there in order to make managing the disease less overwhelming.
To know what works best for you on any given day in terms of food and exercise and medications. And you could be really trying hard and getting nowhere, but because you lack the resources and the education, and that's what we're really there to bridge the gap with that.
One of the biggest obstacles to managing the disease is the healthcare costs.
Strips insulin is several $100s a month. Pump supplies are roughly $15 every 3 days, and it just compounds like that. It just goes and goes and goes. So.
The United Healthcare Group found people with type 1 diabetes spent $5 billion in healthcare costs in 2010. They also found that $194 billion were spent on those with both types, as well as those with pre- and undiagnosed diabetes. Even with high medical bills, Kristen still maintains a positive attitude.
I'm always looking at the bigger picture, and I think I can thank that to diabetes, because without it, I wouldn't have had that ability to think, okay, there's little problems in life, but what's the big thing to look at?
Kristen's maturity has been employed by Anastasia, whose daughter Cassidy is also a type 1 diabetic.
Kristen has become a personal friend of ours. She actually babysits for our children, and as a parent, that is a tremendous relief to me because I know she knows everything about type 1 diabetes.
Anastasia's daughter Cassidy has had diabetes since she was 16 months old. This led Anastasia to pursue a life like Kristen, where she would own the disease. Michael Cadigan, WFT News.